COVID-19 pandemic has affected us all, but the impact has not been equal. Statistics show that some groups have greater exposure to the disease, are more likely to get it, and will suffer worse outcomes if they do. Racialized groups, especially in larger cities, have been affected much more than expected. Understanding why these impacts are so unequal is complicated, and so we've asked Dr. Kwame Mackenzie to explain it to us. Dr. Mackenzie is a leading expert on the social causes of illness, and his knowledge has been sought by governments in Canada, in UK, as well as in international organizations like the United Nations. He is going to help us understand why the pandemic has affected some of us much more than others.
When I think about the impacts of COVID-19, I think of the 3 A's: age, area, and at-risk group. Age. Well, we know that the older you are, the more likely you are to be infected and impacted by COVID-19. Area. Well, we know that urban areas have a higher risk of COVID-19 than rural areas. And we know that the cities of Toronto and Montreal have been the epicenters of the Canadian pandemic. But inside those cities, there are some areas where the rates of COVID are 10 times the rates of other places. So area is really important. And then lastly, at-risk groups. Well, we know that the majority of people who've died from COVID-19 have been in long-term care. We also know essential workers are at high risk, people with existing chronic illnesses, and some racialized groups. And that's been shown in a number of studies.
Many factors have an influence on a person's health. They can include individual factors like age, sex, and genetic makeup. And they can also include lifestyle choices like smoking, exercise, alcohol use, and diet. But other less obvious factors can also play in. Things like where you were born, the kind of job you do, the amount of money you make, your education level, your culture, your support system, and even your access to healthcare. These are social determinants of health. The interactions of these factors with your health and well-being are complex. For example, Canadians with higher incomes are often healthier and live longer than those with lower incomes. Experiences of discrimination, racism, and historical trauma are important social determinants of health for certain groups such as Indigenous peoples, LGBTQ, and Black Canadians.
I think there are many reasons why certain groups have been more affected by COVID-19 than others. Here are 4. The COVID-19 virus is more likely to infect those who are biologically vulnerable, such as the elderly. Another reason is, say for instance, you're an essential worker. You're more likely to be exposed to the virus and therefore more likely to be affected. Another reason is that some people cannot follow public health guidelines. It's impossible to physically distance if you're living in an overcrowded or congregate setting. And then last, some groups such as lower income groups and racialized groups are more likely to be affected, for many reasons, but one is that they're more likely to have existing illnesses which put them at higher risk. In a city like Hamilton, people who live in the poorest neighborhoods live 20 years shorter lives than people who live in higher income areas. And that's because they're more at risk of chronic diseases which are linked to the social determinants of health.
Some of us may face more than one risk factor. Maybe we work in jobs where we have to interact with the public all day, plus we live in households with many other people. These jobs may not provide paid sick leave, and missing a day of work may not be an option. This is called multiple marginalization. It means there are many things added together that put some people at greater risk. These risks often arise due to what we call systemic inequalities. By systemic, we mean that they come from the way that society operates. The pandemic has uncovered inequalities that are built into Canadian society and called attention to the unfair treatment of racialized groups. Our rules, our laws, our policies, our common practices, when they favor one group over others and when they are good for some but not all, it results in systemic racism.
This situation isn't unique to the pandemic, in my mind. We know that there are systemic inequalities in health that have been there for a long time. What's happened is that the pandemic has come along and it's exacerbated them. Part of the reason for that is what viruses do. They try to get into society through our weakest points. So this virus has got into society and multiplied most quickly in the elderly, in low income, and in racialized groups because of multiple marginalization. And so I think that's one of the reasons why we've got differences in risk.
What we have learned during this pandemic is that systemic racism hurts people. People who don't understand the causes of health inequities may spread misinformation, and when that's done to cause harm, that's disinformation. Understand what's really behind the differences in how we are affected by the pandemic. Together, we can stop the spread of disinformation. Check out the other videos in this series to learn more about the dangers of disinformation.